To Christchurch now, where nurses at Christchurch Hospital say their safety is under threat because of a lack of staff car parks near the building. They say they've often forced to turn up hours early or sleep in the car just to secure a park before their shift. Now, it follows the death of hospital worker Kenneth McCaul. He was killed last month when his car was hit during a police pursuit. He left his house in the early hours of the morning and planned on sleeping in his car to get a park near the hospital. Our South Island reporter Logan Church spoke to others who get up early to avoid the rush.
I think it's about 10 to 6 in the morning. We are on Selwyn Street between Hagley and Morehouse, and I parked my car here to get to work.
That's Rosie, a nurse at Christchurch Hospital up the road. We're about a 10-minute walk to work, but she has to arrive at least an hour early to park here, some of the only free on-street parking.
At this time of year it's not as bad, but middle of winter it's cold, it's pitch black, it's a safety issue really. I've had one car stolen and one car with a window smashed in. We're told to walk with our scissors in our pocket, and I don't think that should be really necessary, quite frankly. Yeah, it's pretty bad.
As we walk to Rosie's work, we talk about that safety issue. Last April, a student nurse was assaulted and robbed at knife point after she left work about 10:30 at night. In 2015, a midwife was harassed by a man smashing bottles and hurling abuse at her as she walked along the same road we are walking along now. And last month, hospital worker Kenneth McCaul was killed when his car was hit during a police pursuit. He was on the roads in the early hours of the morning to secure a car park before his shift. Rosie says it's not uncommon for hospital staff to arrive at work hours before they're due to start.
I've got here at 6 and walked past people asleep in their cars.
The CDHB has almost half the number of staff car parks now than it did before the earthquakes. And despite this issue being known for years, a fix has not yet been found. There is simply not the space. So how many car parks are there? Prior to the Canterbury earthquakes, the CDHB had 1,400 car parks available for its staff. But now, only 800, including 430 in the Santigua Street car parking building. Now, about 2,000 staff have access to this building, but 300 people are on its waiting list.
I personally have access to it for night shifts, which is good, but I've been with the DHB for 2 years and I'm still like 200 on the list for during the day. It's quite a small car park and there are just so many employees because you've got doctors, nurses and everything else.
About 5,000 in total. The CDHB has grappled with this issue for the better part of the decade, and no nurse or staff member we spoke to blamed management for the lack of parking. They believed they were doing the best with what they've got. But they are worried that a long-term fix isn't coming. Chief Executive David Mates says the car parking situation has been complicated since the earthquakes.
Since the earthquakes, we've demolished 44 buildings, including significant parking buildings. And what's compounded that also has been the removal of free on-street car parking, which has now become time limited and charged. So what that has meant is a significant reduction in the parking in and around the Christchurch Hospital campus than what used to exist.
He says there are two ongoing pieces of work which will hopefully come up with a solution. The first is looking at a parking strategy for the area with other authorities in the city.
We have been working with a cross-agency working group that includes the City Council, Otakaro, the University of Otago, the District Health Board, to explore a range of options close to Christchurch Hospital. And we're getting closer to being able to, I think, provide certainly an interim parking solution. It will not meet all of the needs of the Christchurch campus, but will be a significant improvement particularly for the public accessing Christchurch Hospital.
If that goes ahead, that would make about 500 car parks available, mainly for the public. Mr. Mates hopes that can be announced in the coming 3 to 4 weeks. The second body of work is looking at a long-term fix with the Ministry of Health.
That is still a work in progress and probably a longer-term process. And I suspect that might be better for you to speak directly with the Ministry on.
So there's no timeline on that, at least from your end?
Not at this stage, no.
The Ministry of Health says in a statement it acknowledges the frustrations around car parking at the hospital for staff and patients. It says, however, it is taking longer than planned due to additional site planning and changes to the wider hospital campus development, which is still to be confirmed. In Christchurch for Checkpoint, Logan Church.